What is a hyperlordosis? Say that, hyperlordosis. Okay, shut up. Now, what we want to do is, there are two types of curves in the spine, right? So there's a lordotic curve and a kyphotic curve. So the lordosis is, the patient is facing this way, I am facing this way. So if you have a curve towards the front, that's a lordosis. If you have a curve face towards the back, like in the mid-back, your thoracic spine, everything with a rib, that part, it should be facing that way, that curve. Now, hypo, hyper, right? Hyper, more, hypo, less. So you can have both conditions, whether, you know. So in a hyperlordotic spine, you have a exaggerated curve of the lumbar spine or the cervical spine, actually, because that is also a lordotic curve. It curves towards the front. A hypo is less than normal. This, I'd say this actually is a little less than normal, but this is definitely more than normal. So you could even have a straighter, and this happens. You could have a almost straight. I've seen patients with that, which is considered a hypolordosis. So why is that curve and the angles important? Very good question. So the question is, go like this with your finger, hit down, okay? So when you hit down, the force is transferred and it keeps moving on until there is a bend in that, right? So then there's accumulation. Now bend your finger just a little bit, put a curve in there and hit it. See how the forces are absorbed? So the proper amount of curve allows some of the force to be introduced into soft tissue, to be dissipated, and that's needed. Why? Okay, there's a thing called Wolff's Law. What is Wolff's Law? Good question. Wolff's Law dictates when bone sees more force, it lays down more bone. Okay, so that's great for athletes, right? Thicker, denser, stronger, long bones. Joints, not good. Because when your joints see more force, your body will lay down more bone. That's Wolff's Law. So what is that when joints see more bone being laid? Arthritis. So having hyper or hypo will accelerate the amount of force on those joints, which will accelerate the degenerative process of arthritis. Okay, so what do? Okay, it's very important because hyper or hypo, basically two different conditions, but they're treated the same. They're seeing more force than normal, than they should, so they're going to be accelerated in their degeneration process. So what do you got to do? You got to move them more, right? How do you move joints? Chiropractor. We got to give you soft tissue work and some exercises, some PT, to help slow it down. It's not going to change. It's not going to change. If it gets to the point bad enough, say like a scoliotic curve, which is a curve, exaggerated curve, in a curve that shouldn't be there, right? So it's also on the A and P, anterior, posterior, posterior, anterior, when you're looking at the person face on and they have a curve this way. That needs to be taken out. So what's done is Henderson rods. If it gets too bad, then there's other hardware that can be put in to change that curve. But once you go that way, there is no going back. There is no going back. So that is why something that is kind of common, because very few people have, the hyperlordotic curve is also called swayback. Back in the day, they used to call it swayback. So the lumbar curve was a little too much. But it is actually a serious issue over time, because, especially if you're athletic, because you are going to exaggerate greatly the amount of force that are seen on those joints, which starts the whole process. So that is a hyper/hypolordotic curve explanation.